I need to tell you about something that an insurance company is trying to pull in Idaho, because it's not just going to be limited to Idaho. These things are going to spread, and it impacts patient care. Regence Insurance in Idaho is attempting to make a 50% cut on what we get paid for a medical visit if we do a procedure on the same day of the visit. This means that if a patient comes in and we do a skin exam on them and identify something that could be a melanoma, we have to ask the patient to come back for a biopsy in the future. This could lead to a delay in care or potentially a missed diagnosis. You need to understand how we bill medical visits. When you come in for a visit and you have an exam and maybe a prescription is written, you're billed an office visit. This is the evaluation and management codes. It's usually a level 1, 2, 3, 4, or 5. Let's say we typically get paid $100 for that kind of visit. If we decide to do a biopsy that might also cost $100, they're now saying that they'll only pay us $50 for the medical visit. Doctor pay has not increased in about 20 years, and I'm not asking you to feel sorry for doctors. We still make a good living, but it is one of the things that's contributing to physician burnout, and it's leading to a decrease in the physician workforce. Because the insurance companies are making more, we have to deal with more paperwork, more headache, and significant increase in our cost of doing business. So if I am now faced on a 50% reduction for an office visit, the most logical thing to do in order to stay in business and be able to serve our patients is to ask patients to come back for their biopsy. And again, this could risk misdiagnosis and decrease in quality comprehensive care, which I like to provide, and every doctor that I know likes to provide. Even though the pay for the doctors would go down 50% on their office visits, your insurance premium is not going down. The insurance company is intentionally trying to restrict your access to comprehensive quality care. If you have Regence Insurance in Idaho, I would encourage you to call them or send an email and tell them not to implement their Modifier 25 policy. This will be catastrophic for private practices, and it will be damaging for even large hospital systems who have outpatient clinics. I love being able to provide comprehensive quality care to my patients, and I strongly believe that if they need a biopsy on the same day as their medical visit, they should be able to get one, but I can't do that for less money than it costs me to run my practice. So patients will be asked to come back from most practices, or offices will have to stop accepting Regence Insurance, and that's potentially tens or hundreds of thousands of people who will now have less access to dermatology care. So again, if you have Regence Insurance, particularly in the state of Idaho or really anywhere, call and ask them not to implement this policy so that you can continue to receive high quality, comprehensive care and get everything done on a day that you need to, so you don't have to take more days off of work and risk a delay in care.